Good day, this is Dr.K Gireesh, physician, neurophysician and neurosurgeon, and as a part of the continuing medical education program on behalf of Padma Clinic and Nursing Home, I will be dwelling into this topic on dementia into three parts. The part 1 will be on the definition of dementia and the symptoms and the signs of dementia. And the part 2 will be on the causes of dementia. And part 3 will be an overview on the treatment of dementia. So, this is part 1, the definition and the symptoms and the signs of dementia. The ICD-10 classification of mental and behavioral disorders, WHO, describes dementia as a syndrome occurring as a result of a disease of the brain, which is usually chronic and progressive in nature. It consists of impairment of several higher cortical functions, which include memory, thinking, comprehension or understanding, calculation, learning, language and judgment. So, that means there is an impairment at the higher cognitive functions, which include memory, thinking, understanding, calculation, learning, language as well as and abnormalities in the judgment. These impairments are often seen alongside changes in emotional control also, in social behavior and also in self-motivation. You find a lot of changes will be there. It is in fact a general term and is used for the loss of memory, language, problem solving and all other thinking abilities which I have already told you. Now, let us see some of those symptoms and signs of dementia. This has been well delineated or detailed by Alan H. Rapper, Martin S. Samu, and in the Adam and Victor's Principles of Neurology, 10th edition, the publications, that is around 2014. It is very well delineated, all these signs and symptoms. There will be a lack of, now these signs and symptoms which I am going to enumerate, it may occur in various phases of the disease. Some of them may be very mild, some of them can be very gross. They are 1, a lack of initiative or a lack of interest in any sort of work, neglect of routine tasks, abandonment of pleasurable pursuits, or development of forgetfulness, not remembering names. The purpose of the mistake is being forgotten. Recent conversation or social events have been overlooked. Cannot discuss any problem with clarity. Cannot understand all aspects of a complex situation. Ability to make proper deduction and inferences from given premises are greatly reduced. Concern shown on unimportant events. Unimportant and not essential events will be given maximum significance. Tasks requiring several steps cannot be accomplished. Patient can get lost even along habitual routes of travel. Day-to-day events are not recalled and the perseverance of speech action are seen. They keep repeating whatever they say. Sometimes unreasonable outbursts of anger, aggressiveness will be there. Apathy, that is a lack of interest in anything, is very common. Easy fluctuation from laughter to tears on the slightest provocation. Some have dizziness, vague mental fogginess. Patient has an inability to give coherent account of his symptoms. Sometimes sleep disturbances, insomnia will be there. sometimes severe confusional state brought about by some febrile illness or any operative procedure or a concussive head injury. A lack of social graces and indifference to social customs. They feel they are not bothered about anything. Judgment becomes impaired. Sometimes suspiciousness occurs. They feel suspicious about everything, about individuals too. As condition progresses, all the intellectual faculties become impaired. They have a lack of insight into their problem. They are not concerned about their disease per se. Memory, most affected is both the reason and remote, but earlier it will be the reason and later on reason and remote can get affected. Impairment of the language functions, apraxia can occur. A capacity to understand the nuances of the spoken and written words are not there. Vocabulary becomes restricted and conversation is rambling and repetitions are very often. Patient develops aphasia, dysarthria, echolalia, loss of capacity to express feelings, to suppress impulses, to tolerate frustration and restriction. That means there is a loss of capacity to tolerate frustration and restrictions. Any febrile illness, drug intoxication, anesthesia, surgery can lead to a severe condition. Patient is unkempt, he is dirty. Patient doesn't or can look after the wearing of a new dress or wearing of a dress at all. 35, patient have vacant expressions. Sometimes they remain in bed most of the time. The above symptoms are a manifestation of the neurological diseases of the brain. When various parts of the brain get slowly degenerated, you find varying parts of these various symptoms. Almost 37 of them I have enumerated. So, these are some of the signs and symptoms of dementia. So, in this part I have told you the definition of dementia as well as the symptoms of and the signs of dementia. Thank you very much.